The vision, a world where all people live free of the burden of drug abuse. This is the Drug Free America Foundation's Pathway to Prevention podcast, where we are committed to developing strategies that prevent drug use and promote sustained recovery. Thank you for not only tuning in, but your continued support and efforts to help make this world a better place. We hope you enjoy this episode.
Hey everybody, this is Dave Closson from the team here at Drug Free America Foundation, and you're listening to the Pathways to Prevention podcast, the show where we chat with stakeholders and prevention leaders from across the drug demand reduction spectrum about current trends in the global substance use pandemic, strategies to reduce drug demand, and how to best adapt those strategies to the ever-shifting substance use landscape. Now, before we start the show today, I want to tell you about the 12th Annual National Prevention Summit, February 17th and 18th, 2025, in St. Petersburg, Florida. The summit this year will concentrate on the effective implementation of prevention and recovery strategies, and will provide communities with the tools needed to advocate for sound drug policies. This year, the training sessions will feature 3 specialized tracks: the impacts of marijuana use, a recovery track, and drug demand reduction from diverse perspectives track. Now, registration is now open, so check the show notes for the link or visit dfaf.org. Okay, so today we're talking with Ariel Cohn, who is a Young Professionals Advisory Board member here for Drug Free America Foundation, and also serving as a prevention supervisor with DCCCA, a nonprofit organization in Kansas, and works in substance use prevention and mental health promotion. Her primary fields of focus are youth tobacco use prevention and youth suicide prevention. We will discuss everything there is to know about being a young professional advisory board member, a prevention supervisor, and youth prevention. So much to cover today, and we're excited to have Ariel on with us. So, hey, welcome to the podcast. Thanks for joining us.
Yeah, thanks for having me. I'm excited.
All right. So I shared a little bit about your background during the introduction, but I did not do it justice. And so I would like to ask, can you go ahead and introduce yourself a little bit? Tell us a little bit about yourself and your role.
Yeah, for sure. So I am the prevention supervisor currently at DCCCA. So part of my role, I have a lot of different hats that I wear, and I think that's pretty typical in nonprofits and prevention work. So one of the projects that I currently work on is our youth programming. So we have a program called YEP, which stands for Youth Empowerment and Prevention. They're sort of like clubs throughout the different middle and high schools in Douglas County. And in these clubs, students get to put on different campaigns and sort of act as those like leaders and role models in their schools by sharing the message of substance use prevention, suicide prevention, and mental health promotion. So I oversee that program, and it's a lot of fun getting to work with all of those students. Another piece that I work on is a pilot program that we are currently implementing for the first time this year. So that's really exciting. There's been a lot of learning along with it. And this pilot program is to allow prevention specialists to sit in a school full time. So just like how some schools have like social workers or counselors full time, we're now working on getting prevention specialists in the school full time to help further support the students, the staff, and the families of the students to provide more services and resources for them. So in that program, we currently have 2 prevention specialists sitting in 2 different districts. So those are probably the largest projects that I work on. And then I also help out with a handful of different trainings and facilitations and things like that as they come up.
So interesting. I can't wait to dive in to learn more about the work and some of the things you've learned over the years working in prevention. I'm first curious about, what was your path to working in prevention? How'd you end up here?
Yeah, that's a great question. So when I was in high school, I think I was about a junior in high school, I started to want to figure out where I wanted to go to school, what I wanted to go to school for, that sort of thing. I am a very indecisive person. So I knew that if I didn't go into college, without a major decided, I don't know that I would have ever decided. So I did a whole bunch of research trying to find what major or what career path felt right for me. I knew I wanted to do something in the helping field. It's just sort of always been important to me, being able to help others make the world a better place, do what I can. My mom also has worked in nonprofit her whole life, so she certainly has inspired me to continue working in that nonprofit field. And then as I was doing some research, I actually took a online quiz that was like, what major should you go to school for, So I took this quiz and it ended up with public health and exercise science. I'm not a science person, so I was like, okay, let me look into what this public health is. And it immediately aligned like pretty well with what I wanted to do. And the nice thing about public health is that it is such a broad field. Like in my undergraduate classes, I had peers who were going into substance use prevention like me. I had people who wanted to be nutritionists or dietitians or sex educators, occupational therapists, work in health departments. Like it's such a broad field. And so I knew that if I went in with a public health degree, I would still have options. So that was sort of exciting. And then as I declared my major, I found a passion for substance use. And I wasn't sure if I wanted to do like rehabilitation or education. I didn't know that prevention was a thing, but the education piece did sort of speak to me. I wanted to be able to help others to understand the risks associated with substances, to be able to make their own informed decisions, to be able to help people to lead healthier lives, basically. And I always just thought like drugs were sort of interesting, especially like with all of the stigma around them. And when I was in high school and entering college, there was a lot in the media about opioids, and a lot of celebrities I felt like were overdosing or going into rehab, coming out of rehab. So it felt like a really big issue. But I personally, in my community, I didn't hear much about like what was being done. And so as I was going through my undergraduate degree, I really started to focus in on that substance use education, including tobacco. And then I went to the University of Kansas to get my degree. And in the second semester of my senior year, instead of taking classes, we take like a full-time internship. So we had to find a place to work 35 hours a week that was in whatever public health field. And so I talked to one of my professors and I said, hey, I'm really interested in like substance use education. And she pointed me to DECA, which is the organization that I currently work for. So I ended up as a prevention intern there for a few months, and I absolutely loved it. I loved the people. I loved the work I was doing. And then after being there for a few months, they asked me if I would want to continue being there and to come on as a full-time employee. So I said yes, and I have been there ever since.
I love that. And I'll give a nod to the folks at DECA because they are all amazing people and an amazing organization. I miss working with them from my time with the PTTC.
Yes, it's a really great group of people. I really love the people that I get to work with.
Absolutely. And before I really open up and dig in and explore the work you're doing there with DECA, can you tell me a little bit more about the Young Professionals Advisory Board? Because I know when I mentioned that in the introduction, I have a feeling a lot of you listeners out there are like, wait, what is that? I didn't know Drug Free America Foundation had that.
Yeah, so the Young Professionals Advisory Board is exactly what it sounds like. It's a group of young people who are working in prevention, primarily in that substance use prevention. And it's young people who want to come together and sort of find that space to connect and sort of put our heads together to see what we can do to make that work more effective and to learn from each other and to help the folks at Drug Free America Foundation to get that youth or young adult perspective. I believe we're all between ages like 18 to 24-ish. So like young, but still in that like professional field, but we're able to sort of like connect or have those connections with some of those like middle and high school age people, either in the work that we do or in like family members, things like that. So we sort of help bridge that gap because as Drug Free America Foundation knows, and a lot of us who work in prevention know, the youth voice is so important in the work that we do. And so we can't do that work without hearing from young people. So I was really excited to get to be a part of it, sort of be that like voice for young folks and for myself. And it's been a really cool learning opportunity getting to work with some of the other young people who are part of it and working with the Drug Free America Foundation, getting to learn more about what you all do has been really cool and exciting.
Where are some of the other young professionals at geographically? Are we talking, everybody's in Kansas or just in Florida or the United States? What's the group kind of look like?
Yeah, so I'm from Kansas. We've also got someone from Michigan and Minnesota. So all over the country. And we actually recently did a webinar, which was really fun to do. We each sort of picked like a different topic to focus on. And we even had folks from outside of the US. We had someone from Suriname. So it was really cool to hear what's being done in other countries and how it's maybe similar to what we're doing or how it's very different. And it was cool to sort of get different perspective. And it was refreshing to hear that there are people all over the world doing this work. Whenever I go to like conferences or anything around the prevention work, I always find it so energizing and refreshing to see that the work that's being done, the work that I'm doing in my one town in Kansas is being done all over the world. And it makes me feel a lot more connected to the work, and it makes it feel like there's a much bigger impact being made by the work that I'm doing. So it's been really cool to be able to work with people from all over the country and even all over the world.
Okay, so you did the webinar, and how often do you all like meet and get together to collaborate, to share, to learn, to grow?
Yeah, so we meet monthly, and of course, with all of our schedules and the time differences, it can certainly be difficult, but we meet about once a month, and that is really a time for us to recently we were spending a lot of it getting ready for that webinar, figuring out who wanted to speak on what and how we were going to relay the messages that we wanted to share. But when we meet, we also use it as a time to update, what we're seeing in our communities, thinking about how we can apply it to other areas, things like that. We also have started a social media page on Instagram. It's called Next Best Gen. So the goal of Next Best Gen, or the meaning behind that, is we're hoping to empower the next generation, so our generation and future generations, to choose to be drug-free. So hoping to be that next best generation. So that's sort of where the meaning behind that name came from. And so through that social media platform, we are working to spread our message, to provide education, to provide resources and support, and hopefully reach other young people who are doing similar things that we're doing. So either to get them to join the board, to be a part of this work, or even just to get more perspective.
Listeners, check the show notes. I'll put the link to that Instagram profile, and I will also be following that tonight if I'm not already. Yeah, it's just building community, just helping the community grow across the globe to come together. And you may not know this yet, Ariel, but my shirt says prevention is better together, because that's my motto, and that's truly what I believe. And that's what y'all are doing, bringing people together.
Yes, I love it. It's very important to do that prevention work with community members, with other folks, right? You're exactly right. We can't do it alone, for sure.
As you think about your time on the Young Professionals Advisory Board, what are a couple, fun or fond memories so far?
Yeah, I think when we first started out, we all sort of met, and the folks from Drug Free America Foundation sort of said, what do you all want this to be? So we sort of got to frame it and rework it and figure out what we wanted our message to be, how we wanted to share that message. There was a lot of freedom and flexibility with it, and we got to, create that next best gen. We got to create some social media posts. We got to plan that webinar. So it was really cool to sort of be given this opportunity and to be able to basically do whatever we wanted with it. It was a really special thing to get to work on and to get to sort of form and be a part of.
Now, what do you see as some of the benefits to being a part of the board? What are some of those benefits?
Yeah, I think one thing that I have found being part of the board is that it helps me in the work that I'm already doing. It reminds me to take a step back, reframe, to not get stuck sort of in that silo or in that vacuum. So that's certainly been helpful. It's also been cool just to see what else is happening. Because I work in substance use prevention, I, of course, just find it really interesting. One thing that is particularly interesting for me is hearing about marijuana across the country and across the world. For example, in Minnesota, they just recently legalized marijuana. It's not yet legalized in Kansas. So it was really interesting to get perspective and to hear what it's like to be a prevention professional while marijuana is being legalized. And the person in Minnesota, she also works with young people primarily. So it's been really interesting to hear what she's doing and how she's trying to be proactive and what she's doing with education and programming with the young people amidst this really massive change in their climate. And so sort of thinking about trying to be proactive of if and when that happens in Kansas, I want to, be prepared. So sort of having her go through that first has been nice for me. So yeah, it's just been a cool learning experience. I definitely identify as like a lifelong learner. And so it's just been another opportunity for me to be able to do that and to be able to like bridge that gap again between the adults who are doing the work and the youth who the work is really for.
Yes. And what opportunities are you seeing? Right along that same line, what are all those opportunities that are starting to emerge?
Yeah, I think it can be really difficult to find that youth voice. So I think being able to sort of connect the two has helped us, or has helped me at least, feel like I'm able to do my work more effectively. It's really cool to hear about all of the different things that are happening and what is new and what's working in one place and what's not working in another place. So I think that I think there's still a lot of opportunity for growth and more learning, but I also think that there's an opportunity for other areas or other fields to sort of take on this approach of finding that like sweet spot of those like young adults, those young professionals, having that, like fresh and new mindset, being able to sort of help bridge that gap, being able to still get that information from young people. Because one thing that I found working with middle and high schoolers is that oftentimes they do want to be a part of that conversation, but their schedules make it really, really hard. Especially I found that the people that are part of, my youth programming and the kids who really want to be involved in that mental health promotion and those leadership things, they're already in everything. So it's really difficult. So this was sort of a really unique and cool way to be able to still get their voice, to still get some perspective without making it too much of a heavy lift. I do certainly think that there's more opportunity. I would be interested to see what a board might look like if it were like high school students across the country or across the world, and see how their projects or their ideas would differ from ours as like 18 to 24. Because I know like age-wise, it's not a huge difference, but life experience and perspective would be really different. So that I would be really interested to see, and I think that would be cool.
I'm curious because I'm farther removed from that age demographic than you are by many years. And so when I try to imagine ideas or what they might see as innovative ideas or out there, I'm drawing a blank. So can you translate for me what what even, like, give me some ideas. I have no clue.
Yes, and that's part of like the fun of the advisory board. Some of the stuff even that we come up with, I'm like, I don't know that that's something that high schoolers would like, so it's a lot of like trial and error. Kids now, I think social media is just about everything, technology, all of that stuff. They're a lot more, I found at least, they are a lot more in touch with their mental health and prioritizing that. I also find for the most part, they care about their friends. They want people to be okay. They want them to be successful. And they also seem, surprisingly, one thing that surprised me at least is that working with kids and talking about drugs, I didn't really expect much conversation, or I didn't really expect much interest, or, I maybe expected them to brush it off or something like that. But I found that they're really open and they're really curious and they ask tough questions, which is really cool to see and to watch them, process and think and frame it in a way that makes sense for them. I certainly feel like I learn a lot from them and it's cool, especially I will say with like social media. I am certainly not a graphic designer or a social media manager by any stretch of the word. And so it's cool to see what kids like think is cool versus what I think is cool. Like when I try to make some sort of like social media post. So I definitely use their ideas as inspiration to try to frame the messages that we have in a way that will be more receptive to them. And it's certainly not a foolproof method. I certainly don't get it right every time, but I think trying to speak their language in a way that's not like condescending or patronizing. I find that just speaking to them like you would speak to anyone else, really, they're a lot more perceptive and capable and intuitive than I think people give them credit for.
They want to be heard, seen, and respected.
Yes, 100%.
So you said two things there, and I wanna pull them out just a little bit more. And the first one being, you said they ask really tough questions. And in my mind, I have this deer in the headlights. Oh my gosh, I'm there in the room. These youth just hit me with this question. I don't know the answer to it. It's a lot of pressure to have all the answers. Like, how do you navigate that situation?
Yeah, actually, I really like when that happens because it forces me to stretch my brain and it gives me a chance to find an answer that otherwise I wouldn't have had. Usually, I am just upfront. I'm like, I have no idea. I will find you an answer and I will let you know. That happens pretty frequently. I do some quick research. I see what type of answer I can find and I get it to them in whatever way that I can. Because, yeah, you're right. I think it can be tough and it's impossible to have all the answers, right? So I do my best.
I feel like I've heard a lot of folks have that same feeling of, oh, what if they ask me about the scientific makeup of THC and cannabinoids and all this science stuff that I don't know about? Honesty, transparency, and authenticity. That sounds like that's my summary of what you said.
Yeah, for sure. Yeah, I think being honest, and even if it's something that the two of you like go research together or learn more about together, especially thinking about like parents with their kids. I know drugs can be a really tough topic, and a lot of times parents either don't know where to start or they're like, well, I'm just not going to talk about it, or I don't know what to do. I think inviting your kids into that conversation, I'm of course speaking as someone who doesn't have kids, so it's a lot easier said than done for me. But I think trying to bring them into that conversation, and instead of having it be like, you need to listen to me and what I do and what I say and my rules, instead saying, let's like work through this together. Let's learn about it together. Let's figure out how we can make safe decisions and be safe around it together.
So I want to send you a link to an old episode. I don't remember how many episodes it was, but it was with Dr. Crystal Collier. And she has the Know Your Neuro curriculum and books. And it packages the brain science behind high-risk behaviors and substance use and she has it articulated to communicate to parents. And then there's a different set where it teaches it to youth in the different age groups as well, to know that how substances, how the brain actually works. Know your neurons, your neurotransmitters, your brain. Really fascinating stuff. And then hearing you say, the youth want to know about this. They want to engage in the conversations, and rather than be the expert and have to research it all, she's done all that for us.
That's awesome. Yeah, that's cool. I am always on the lookout for new resources to help educate kids, families. So yeah, I'd love to check that one out.
Like, yes. And just, it's a wonderful, wonderful book resource. She's got a whole suite of books and a lot of things on her website. So I'll send you the link, and happy to introduce you to her as well.
Cool.
That second topic that I wanted to kind of throw out there is more of a hypothesis or an old guy curiosity as it relates to youth and social media. And it just popped in my head when you were talking. I haven't fully formulated, thought through, or investigated it, but you know what? I'm the host, so I'm just going to throw it out there anyways. I'm curious what your thoughts are on if you feel like the younger generations, the youth, have a different mindset when it comes to social media. I see the adults, folks my age, we've got to put out this information and push information dissemination. And then we throw our hands up. Nobody's liking our posts. Nobody's sharing our posts. And so my curiosity is, how do youth approach, or what is their mindset for social media?
Yeah, that is tough, because I see it from the adult perspective of, we have an easy way to reach a ton of youth. So why are they not interacting with it? I don't have the perfect answer. What I have found is almost tricking them into getting that information. Like, if you post something that talks about like the dangers of opioids and fentanyl, odds are they're going to see like a chunk of text, or they're going to see something that looks educational and be like, I'm not on Instagram for that right now, which is understandable, right? So finding other ways, I guess more creative ways. Of course, TikTok is so popular right now. So finding ways to sort of tie in the information that you want to share in a way that is fun and interesting. Unfortunately, trends come and go so fast. So I see so many like companies and organizations hopping on those trends to promote their business or whatever it may be. But by the time they, plan their post and get it made and post it, the trend is like basically done, right? So then it's not as effective as it maybe could be, which is not something I have the answer to. But I definitely think leaning into some of those trends, making things more lighthearted and goofy, sometimes a little bit weird, whatever is gonna, catch their attention, to make them maybe pause and say, wait, what is this? And then after, they've looked at it for a minute, they're like, oh, they're trying to teach me something. But at that point, you've already reached them a little bit. So I don't know. Trickery works sometimes.
We'll call it creativity.
Love it. Some creativity. Yeah.
Sort of behind my curiosity there was that in working with my marketing team, they kind of said the same thing, like, we're not going to chase trends. We're approaching social media with a spirit of relationship building and want folks to have a chance to get to know me and who I am, what I stand for, and just a chance to build connection and build trust. So then when it comes time to disseminate information, there's that foundation first. It's like they talked about, like, imagine you're out walking through the park. You're just going to walk up to total strangers and start saying, hey, let me tell you about this, and this. You need to know this. Don't do this. Or you're going to walk up and say, hey, I'm Dave Closson. Nice to meet you. Get to know each other. Have some small talk, but you're building rapport. You're building that foundation, that relationship. So then you say, hey, do you mind if I tell you about?
Yeah, I think that's huge. I think you're 100% right on that. Another thing, sort of as you were speaking, that made me think, oftentimes, at least I'm thinking in the people that I follow on social media, a lot of, well, like political things, of course, are an easy thing for people to repost, but people also, I think, use social media to share their values and their interests with the other people who follow them. So if they're really passionate about prevention, or maybe they're really passionate about mental health promotion or whatever it may be, if they follow a page that posts something that resonates with them, they're likely to repost it. And so then our message then is getting spread through them. And if one of their friends sees that they posted it, they're, I think, more likely to take a look at it if it was sort of like recommended to them by a friend. If they see that their friend follows them, that the friend agrees or believes in whatever it is that that organization is posting. So I think also finding ways to make like repostable content can be a really powerful thing too.
Yes, absolutely. And I would dare to say too, some of the things you were sharing when I asked about how you navigate when you get asked those tough questions and you don't know the answer, the being honest, the being transparent and authentic. I feel like that would translate very well to social media as well.
Yes, I agree. I think that's huge. I think the young people of today are able to detect that like fakeness and that, like marketing talk type of thing. And you're right, they really don't respond super well to it. So I agree with you. I think that authenticity, transparency, and I think when they see people being honest, maybe being vulnerable, it makes them feel more comfortable and more willing to interact.
Mm-hmm. Yes. Oh, we've uncovered so much wisdom and insights already as it relates to working with youth and being in that sweet spot between the youth and the professionals doing the work. And I want to continue down that lane, and I want to hear a little bit more about the work you're doing specifically there in Kansas. You shared sort of your two main roles there, and you tell me a little bit more about those.
Yeah, so I'll talk about the youth programming piece first. So again, that's called YEP, stands for Youth Empowerment and Prevention. It started back in 2019, so a few years before I came on at DECA, and it originally started, it was just a couple of students in Douglas County, so like Lawrence, Kansas area, and it just was a couple of kids who were interested in substance use prevention and mental health promotion. They got together and helped plan different like projects and campaigns for the community. And now it has grown exponentially in the past 5 years. At our kickoff event for this year, we had about 130 kids show up. So that was really, really exciting to see how much energy there is in Douglas County around this work. And of course, the kids get lunch, they get out of school for the day. So there are some other factors, but I like to think that they were there really to learn and to hear about the program. But the program really focuses on a couple of different pieces. So we've got a substance use prevention piece. So one way that we do that is through a program called Resist. Resist is a statewide program through the Kansas Department of Health and Environment, and it is a program designed for young people to advocate against big tobacco companies, basically. So some things that we've done with Resist in the past, every year they host something called Take Down Tobacco Day, where students from all over the state go to Topeka, which is our capital, and they get to talk with their local legislators, talk about what it's like to be a kid in their community and how tobacco is impacting them, their family, their peers. And of course, they get to meet kids from all over the state who are passionate about that same work, which is really, really cool. Another thing that we've done with Resist is a park cleanup. So we pick a park in our local area and we go around, and anytime we see a piece of litter that is tobacco related, so like cigarette butts, disposed vapes, empty cigarette box, anything like that, we put like a little orange flag and then we pick it up as we go. And then after an hour or two, we take a look around and we see how many flags we have, where those flags are, where do people tend to use these tobacco products and then toss them on the floor. And it was really cool. And actually, when we did that one, as we were picking up some of that trash, the director of the Parks and Rec department of that area happened to be at the park, and he asked what we were doing, what we had going on. So the kids explained it to him. And he was so impressed that we had something like that in our community. And he was so grateful that we were there helping to make the park a better and safer place. And we had an interesting conversation. He was shocked by how many flags he saw because that park was supposed to be a tobacco-free park or a smoking-free park. And we saw quite a lot of cigarette butts. So yeah, that was sort of funny. But it was cool to get to see the kids interact with him as well. And then another piece of the youth program is Sources of Strength. So that's the suicide prevention aspect of it. Sources of Strength is a nationwide organization that works on, they call it strengths-based suicide prevention. So instead of focusing on the negative pieces of suicide prevention, we look at suicide prevention as a way to enhance our strengths. So they've got 8 different pieces or protective factors that they focus on. And so the students also, they get trained in all of that. So they learn all about the different pieces. And then they go back to their schools and they put on a campaign. And by campaign, it could be a video, it could be a presentation, it could be a poster board, it could be an after school event, something, it could be literally anything they want. And then through that campaign, they share the message of Sources of Strength. They share the message of YET, so that they're the experts in their school, but then they get to share the wealth and they get to inform their peers and bring their peers into that conversation. And so it was really cool to see the students, get a chance to be creative. So those are really the main pieces. And then of course, we focus on that mental health promotion. We've also recently started to do some work with healthy relationships as well. So thinking about how to be a good and safe friend and how to, identify maybe some of those red flags or warning signs in relationships that maybe we need to step back or reevaluate or have some tough conversations. And the kids seem to be really interested in that too. So I'm trying to see how else we can tie that in, because I was surprised, but the kids are really interested in that healthy relationships piece too.
What have been a couple good things you've learned since you've been working with the youth in the 3 different programs there?
Yeah, it is hard to engage young people. That is certainly something that I have learned. When they're there and when they're interested, it is incredible, but sometimes it's tough to get them in the door. So it certainly requires some creativity, some flexibility, some compromise, and a lot of listening to hear what they want, what they need, and finding fun ways to try to work that in to what has to be done, per all of the grant requirements and all of that, trying to find that happy medium. Some other things that I've learned is that kids want to be successful. They want to see their friends be successful. They want to make good choices. They want to help themselves. They want to help their peers. But sometimes they don't know the best way to do that. And just as it was when I was growing up, and I'm sure for many other people from many other generations, growing up is really hard. They're dealing with all of the trials and tribulations of being a kid, going through school, issues with friends, issues with school, maybe issues with home life. And they also now have social media on top of it, which a lot of us didn't grow up with having that, at our fingertips, which certainly has an impact as well. And they're also now trying to figure out, who they are and what they can do to make a positive impact in their community. So it's cool to see how much change they go through and how resilient they are and how much they want to make a positive change in their community to make it better for themselves, but also for everyone around them.
That that finding out who they are piece, that identity piece, and pairing that with sources of strength. And that makes my heart happy. I know you don't know my personal story, but coming back from Iraq, I struggled with PTSD and addiction. And what really helped me the most was when I started applying post-traumatic growth, focusing on the positive and leveraging those strengths, those same kind of mindset. And so I believe in it because I've lived it and experienced it. But I'm curious to learn, how do you help youth find their way, find their identity? Like, I can't imagine, like, how do you help a young person find their identity, find out who they are?
Yes, I have certainly had those conversations with youth. With that sources of strength content, it's kids have no problem saying, well, that doesn't apply to me. I don't have any strengths, And I think sources of strength does a really great job of making it so relatable and like palatable. You don't need a degree to understand what it means or what it does. It can just sort of be a powerful thing. And so there's 8 pieces of the wheel. We'll see if I can rattle them off. We've got family support, positive friends, mentors, healthy activities, generosity, spirituality, mental health, and physical health. And they came to these 8 pieces of the wheel, these 8 sort of main strengths in our lives, after the founder of Sources of Strength did a whole bunch of research, seeing what helped people, what did they consider strengths in their lives, and then sort of categorized them and found that those were sort of the 8 categories. And so as I'm helping students sort of understand these 8 pieces, if they're, sort of saying, well, it doesn't apply to me, there's nothing good that I can think of in my life, just asking questions, sort of starting a conversation like, oh, like, what did you do last weekend? And they'll say, oh, well, I had a soccer game and then I helped my grandma make dinner and then I went to my job for a few hours and then went to bed and now here I am at school. They just listed a whole bunch of strengths without realizing it, right? So they went to a soccer game. That's a healthy activity and it's probably good for that physical and that mental health. And they probably have friends on their team. So there you have positive friends, right? And then maybe they go home and cook with grandma. That's a healthy activity. Grandma could be that family support. Grandma could be a mentor, things like that, right? And then maybe they work at their job, right? That's really important, right? For our mental health, maybe for our financial health as well. That can be something positive too. And then being able to go to school, seeing your friends, maybe they've got a teacher there that they see as a mentor. There's a lot of different things in their lives that they maybe don't identify, because sometimes it does feel like when people talk about that, like self-care, it feels really big and really daunting and that sort of like cheesy, like sitting in a room with lit candles and like meditating, it can be hard to see it in everyday life, but it can be. And Sources of Strength does a really great job of explaining it that way too. Or even if kids say, like, well, I didn't do anything, but I see that they've got like a shirt that has Spider-Man on it. I'll say, oh, you like Spider-Man? They're like, yeah, I do like Spider-Man. Okay, do you watch the Spider-Man movies? I know nothing about Spider-Man, by the way. And they're like, oh yeah, I've seen all the movies. And I'm like, that's a healthy activity. If you like watching movies, that's healthy, right? It's not harming yourself. It's not harming others. That's a healthy activity. So the goal is really, if you can help a kid find one strength, it's a success. So long-winded way of saying that everyone has strengths. They might just look a little bit different. You might have to help them dig them out a little bit more.
I would dare to say it's that same with adults too.
100%.
Yeah. And you also had me thinking, so I'm trying to connect dots as I think back on what we've chatted about. You talked about the youth being very curious, wanting to learn about their awareness of mental health and wanting to support and help each other and sort of be healthy. And that and Sources of Strength, the sharing what you just shared now, kind of reminded me of something that I try to remind myself of and also others, is that self-care what seems to me to be the norm, perceived norm, we'll call it, is that self-care is more like a treatment. You get stressed out, you get wore out, you're overwhelmed. I need to take a mental health day or do some self-care. But I like to challenge folks, and I challenge myself to try to think about it in terms of prevention. Instead of waiting till I get to crisis or I'm exacerbated, just making those self-care activities a part of my daily life to prevent me from reaching that level of overwhelm or exhaustion. And it kind of sounds like that's what you're doing with sources of strength. What are those? Finding those strengths and identifying them and continuing to do them and recognizing
100%.
them.
Yeah, it is designed to be there before we reach that crisis, right? So, everyone goes through tough stuff. Everyone is going to have hard days. Everyone is going to have bad days. We're all going to respond to things differently. The goal is to give them the tools to know who they can turn to, what they can turn to help them get through those tough times. And it's a really interesting conversation with kids talking about that. It's cool to see them sort of process the idea that everyone is going to have tough days. Nobody's perfect, right? And to me, I think that is especially meaningful to get to see that, because when I was in high school, I certainly had that idea or perception that I was the only one going through a tough time. And when you're in middle school, high school, like, the world revolves around you, So I was like, I must be the only one who's having a hard time, who's having a tough day, whatever it may be. And so as I've matured and learned and all of that, I try to give them the perspective that I gained, that I wish I would have had when I was in high school. The idea that it may seem like on the outside, everyone is cool as a cucumber, everyone's just cruising through life, when that's probably not the case. And I think that can help kids to feel less isolated, less alone, less like they're the only one who doesn't have it all. I think that's a powerful message that I feel really lucky to be able to share with them.
And I've been working with a resilience and nervous system coach for several months now. Yes, as a fully grown adult, still working with a coach. And I like to think, too, that resilience should be the ninth component on the wellness wheel, building our resilience skills. And the way she articulates it is that adversity in life is kind of like waves in the ocean. They're always going to keep coming. Some are going to be bigger than others. But when you have everyday resilience, you're able to ride those waves like a professional surfer. You have the skills and knowledge and ability to be able to handle those and just ride them so they don't throw you under and take you out to sea.
I love that. I have not heard that. That's really cool. I might have to steal that one, because that's a really cool and easy way to understand it.
You put a picture of a surfer up on a PowerPoint slide, and that's all you need, and boom, they get it.
Exactly.
I'll have to introduce you to her as well. She also leads the Hey, I'm Here, Ohio program. It's a youth mental health and resilience program across the state.
Very cool. Okay.
Yeah, I feel like y'all would jive pretty well.
Cool.
Side note, I just looked at the timer. We've been chatting for about 54 minutes. Holy cow, this went by quick. At least it did for me. So before we unfortunately wrap this conversation up, we could chat for hours. You're a fascinating individual doing amazing work.
Thank you.
I would love to continue this conversation, but I know our listeners have stuff to do as well. They've got long to-do lists, and I know you do too. You stay busy. So before we wrap up, I have two last sort of questions, and one being just open space to share, to talk about anything we haven't covered yet.
I think prevention is truly the answer to all of life's issues. The more that we're able to be proactive and go upstream, as a lot of us like to say, the more that we're able to do that, the better the outcomes will be. And the tricky thing with prevention is we don't always see it right away. I have learned that in my short time in prevention work, is that you can work for a year on something and you might not see the benefits of it until, a few years down the line. So that is certainly something that I've learned, but it has also helped me realize just how important that prevention work is. And I think it gets lost in the weeds sometimes, because when people are so busy putting out fires, which of course is needed and is always going to be needed, that there are those people quietly sitting upstream, trying to help lighten the load a little bit. So that's really, I think, the cool part of prevention. And I really enjoy being able to work with other people who get the importance of that prevention piece. It's sort of a hidden field, but I love it. And I have a lot of respect for other folks who work in that prevention field.
Prevention is everything. Can I highlight, underline, bold, exclamation point that statement right there? All right. So my last question is a fun one for most of my guests. Final parting words of wisdom. If you were to tell our listeners, if you're going to remember one thing from this episode, remember this, what would it be?
I think some good parting words or something to keep in mind as someone who works with youth. They are capable of a lot, and I think it is really important to listen to them. Obviously, they're going to be goofy. Sometimes we do sometimes have to step in as the adults, but allowing them the space to be creative, to be curious, to grow. And maybe that is through being goofy and being silly. We try to make it fun. We try to make learning fun, but giving them the credit that they deserve, I think it's really, really important, because a lot of us are doing this prevention work for these young people. We're doing it for a brighter future, for a safer community, for a healthier world. And so if we're doing it for them, but we don't take the time to listen to them, bring them into that conversation, what are we really doing it for? So I really admire all the young people that I'm able to work with. So I would encourage others to take that time to make those connections and to listen to the young people in their lives.
Wonderful words of wisdom. And with that, thank you for being here today and sharing your story, your journey, and your wisdom with us. It's been an absolute delight. And I look forward to future conversations and also all the great work you are doing through the Young Professionals Advisory Board. Thank you for being who you are and doing what you do. Until next time.
Thank you.
That concludes this episode. Thanks for tuning in. Be sure to hit the subscribe button and share this episode with a friend before you leave. And we look forward to seeing you on social media, because prevention is better together. And together we are stronger.